Does this look really bright? Does this look bright? Let's see. Go to auto. Any of the questions I've gotten were very easy, like they're very typical. Why pharmacy? Was it even why pharmacy? I think it was just like more why their school. Both schools I interviewed at asked why their school, so definitely do your research on that. I'm not even sure if I can even really say specific pharmacies questions, so I won't really say that out loud. Things I prepared for that haven't been asked me is what are your strengths and weaknesses, so know that. And for your weaknesses, make sure you have a comeback reason, like maybe you say that you might procrastinate a little bit, but then doing that you time manage. Another question that I've been ready for is why pharmacy? Yeah, you definitely should have a reason why you want to pursue pharmacy, a good solid reason. I'm surprised I haven't been asked that yet. I should go through my list right now. This is a list of questions or subjects that I wrote down before I even interviewed anywhere, which is first, tell me about yourself. Just say a good amount about your education, where you went to school, what you're pursuing, and then throw in a little hobby in there so it throws some personality. And then, strengths and weaknesses, why pharmacy, important influence in your life, how do you deal with stress? I think this is a good question too, because pharmacy school is very time consuming, it's very accelerated, and you should be able to handle this kind of work. I have defined professionalism, which I want to say, which I feel like is actually a kind of a hard question. Like if I get asked that question, I'm planning to say professionalism is where you carry yourself well, you're prepared for anything that is to come for your profession, acknowledging your specific duties and responsibilities, just ensuring you have the skills to do your job. I haven't really thought about it too much, but that's what my answer would be. There's a question that I also prepare is also like, what if you don't get into pharmacy school? What are you going to do? My answer is because I don't see myself doing anything else, I'm going to do what it takes to apply next cycle, even if it means retaking the PCAT, exposing myself to different pharmacy settings, and volunteering, and just, retaking some classes that I didn't do as well in, and make sure that I'm a more competitive applicant next cycle. Another question is, what have you done to prepare for pharmacy school? For me, I volunteered in a hospital pharmacy for I think a year and a half or so. I have about 200 hours of volunteering experience in the hospital setting. I also work at a medication management center where we ensure patients get the most benefit from their medications and ensure there are no drug interactions or safety concerns. I also reached out to a compounding pharmacist who owns her own pharmacy, and I asked her if she was willing to have me shadow her for a day. And I also joined the pre-pharmacy club too. So I feel like I have a good variety of things of what prepared me for pharmacy school. I'm not sure if that's the way you want to answer it too. Maybe they mean like, are you ready academically wise and like time management wise? But yeah, so what kind of future do you see in pharmacy? And you can talk about provider status, when so far it's not a federal policy, but many states already have provider status, which means we're very close to being able to prescribe medications and bill for it. I know California, you can prescribe birth control, and provider status is pretty much the beginning of a new transformation in healthcare. There's also medication management therapy, helping patients with chronic illnesses and taking multiple medications, ensure that they don't have any drug interactions. Where I currently work, that's what I do kind of as a technician, and just overall having autonomy. Another question I'm prepared for is, what role does a pharmacist play? And notes I took here is that we're pretty much the medication experts. We're a key player in the healthcare team. A question they might ask, what recent news will affect pharmacy? I'm either going to talk about EpiPens or Trump wanting to get rid of the Affordable Care Act and supposedly make insurance better, so that might decrease healthcare for a lot of people who can't afford healthcare, which means they won't get their medications, which will affect us too. And those questions, all I listed there, I haven't been asked, but that's how far I went through questions and that I found online to make sure that I'm prepared for anything like that. Also, in the end of every interview, they ask you if you have any questions for them. Make sure you ask a question. Some questions I ask is, what do you recommend students to be involved in their first year of pharmacy school? And it's usually going to be either research or organizations, but you know, like, ask more into that. I mean, you want to be involved too. I mean, I want to be involved. So see their options that they have there. If it's a faculty member or a student, I want to ask, like, why did you choose to go here? Like, why did you choose to work here? Why did you choose to get your education here versus going to other pharmacy schools? One of my interviewers in my last interview, she actually does research, and I asked her about, you know, her research opportunities. My last 2 interviews, I was pretty nervous going there, but once you're in there, it wasn't as bad as I thought it was gonna be. I have my suit jacket in the back, but this is what I'm wearing on. All right, guys. Oh, I'm running out of memory. All right, I'm gonna go into my next interview. Wish me luck. I mean, I'll be already doing it by the time you guys watch this, but all right, bye.